I just can't understand if there are people not immunized, that we have the availability of vaccines, we have the availability to stop disease.
Stakes are really high. These diseases kill people.
You don't want it to take an epidemic to have people get the immunizations they need to protect their children and their community.
So it was a goal of mine to get kids immunized. When this started, we were at 67% compliance. And I thought, how does that happen? So I started working hard on this project. I chose two wonderful parents, and I just thought they had some enthusiasm that I needed. They had a following of parents that really listened to them.
She asked if I'd be interested in doing a volunteer parent kind of education with vaccines. And I didn't really know much more about it except that it was a good fit for me as a nurse and as a mom at school.
Jory hasn't had her Tdap booster. We're not going to let her.
We work at large school events where we get several hundred students and parents. We work with Nurse Peggy to disseminate information through the school newsletter, and then also in more one-on-one ways just as we meet other parents at playgrounds or sporting events in the community.
It's not surprising to me that parents trust their friends. We trust each other to give us advice. Our family, our friends, our network is so powerful. We've chosen them for a good reason.
You think immunizations too would?
You're listening to people, you're empathizing, you're being an advocate for your community and your children, and you're not judging people for having different opinions than you. I don't want people to see my number on their cell phone and not answer the call or walk the other way because they think, oh, it's the vaccine lady. One of the things that brought me to this program was seeing so much misinformation out in the public.
I think the first thing parents experience when they go online to research information and data on vaccine safety is fear. It is so hard as a parent to decide who to listen to.
It was tough to see celebrities using their moment to shine and saying things that aren't true, that aren't science-based, that have no merit being out there, and they're really influencing a lot of our families.
When people express concerns about vaccinations to me, I tell them to please just ask their pediatrician, because that person, as well as themselves, have their kids' best interest at heart.
You ready? Go ahead and spin the wheel, my friend.
It looks like a very small wheel of fortune, but we call it the wheel of misfortune, and there's a disease that's associated with a vaccination in each pie slice.
What did you land on?
Say it would land on chickenpox, then we'd ask an age-appropriate question for them. And the simplest questions, true or false, if you get chickenpox, you get it from a chicken. And you'd be amazed at how many kindergartners might think you get chickenpox from a chicken. For me, it's not just about keeping my kids healthy and safe. It's about my civic responsibility of keeping our community safe at large. And we have kids that are too young to be vaccinated, elderly that are too frail or immunosuppressed and can't. So for those folks and for the folks that choose not to vaccinate their kids, I want to know that we're doing the best job we can to get as many folks vaccinated, protecting those that aren't.
At the end of last year's school year, we were at 95% compliance with our immunization. To us, that's achievement.
If we impact even one family to change their decision or have them look deeper and say, hey, you know what, there's something to this vaccine thing, that it's worth it. Are you ready?
Protecting our community, and particularly getting all of our kids immunized, is a team sport. It takes parents, it takes grandmas and grandpas, it takes teachers, it takes physicians, it takes nurses. It takes all of us coming together to make sure that everyone in our community is immunized so that all of our kids are protected.